is 1 o'clock. I know as people will come in from one Zoom call from another, as we all do. I'll just start by introducing myself. Welcome, I'm Maria Marshall. I am the director of the North Central Regional Center for Rural Development. Welcome to our webinar series. I think this webinar is going to be just wonderful. Can you go to the first slide there? Sorry, I moved over.
Yeah, sorry, I don't know where my mouse is. This is just typical. There we go. My bad.
No problem. Well, welcome to the webinar on direct experiences operating a rural child care center in Indiana. Our speaker today is Dr. Jennifer Finders. She's assistant professor of human development and family studies at Colorado State University. And if you're wondering, then why is she working on Indiana? It was because she was at Purdue University in human development and family science at Purdue. And policy chair of the Center for Early Learning. Jenn's research focuses on the role of early care and education programs in promoting cognitive, behavioral, and social emotional learning among children from underrepresented backgrounds. She's particularly interested in studying policies and practices that aim to increase equitable access to high-quality early learning opportunities. Thanks, Jenn. We're looking forward to your webinar today. And our next webinar for next month, and the last one for the semester, we'll get to take a 2-month break, is the regional polls insights from the 2024 multi-region household survey, where we'll be discussing and providing some examples of what's available in the 2024 regional baseline surveys for the North Central, Southern, and Northeast regions. And with that, Jennifer, take it away.
Great. Thank you so much for the introduction, Maria. I'm really excited to share some of the results from a project I worked on, as Maria mentioned, while I was at Purdue University. And in this study, we were really focused on understanding the operating costs and revenues of childcare providers in rural Indiana. And I just want to also say thank you to all those that are tuning in. I see some familiar faces, so it's great to have you all here and appreciate you attending. Okay, so before jumping in, I just want to acknowledge our team. This was a really, truly collaborative and interdisciplinary effort. Tanya Hall at Purdue Extension was instrumental in providing expertise around the rural context in Indiana and helping us to determine what our rural definition will be. George Rickus, who's an independent consultant, he also owns a winery, which you can see here in this picture. Served as our cost modeling guru and provided knowledge around childcare operating costs, which really helped to inform some of our focus group questions and analysis. Jacqueline Sandel is my graduate student at Purdue, assisted with scheduling and administering the focus groups and leading the coding efforts with a pretty large team of undergraduate students. And then finally, Sarah Schmidt, who's one of my research mentors at the University of Oregon, who was also previously at Purdue, provided a lot of support and connection and networking on all aspects of the project. So just want to make sure to acknowledge our team here. So here's our agenda for today. I'm going to start with some background on the issue that'll kind of lay the foundation for what motivated this work, describe our study design and methodology. I'll spend the bulk of the time reviewing results and then end with a few key takeaways, as well as hopefully have some time for discussion and questions. So starting with our background here. High quality early care and education is critical for children's brain development, which sets the stage for lifelong health, education, and employment outcomes. However, there's also an economic argument to be made regarding the importance of childcare, because as is obvious to anybody who's a parent, families need access to reliable care in order to participate in the workforce. Unfortunately, we see in Indiana, and I guess I shouldn't say unfortunately because this is common across states, only about 62% of Hoosier children who need childcare are able to be served through existing capacity. And this comes from some of the work that Early Learning Indiana has done around the Closing the Gap report, which I highly recommend you visit if you haven't yet and you're interested in this topic. The U.S. Chamber of Commerce also released a recent report that detailed how childcare impacts Indiana's workforce productivity in the state's economy, estimating that Indiana loses approximately $4.2 billion each year due to insufficient childcare, with more than 80% of those losses explained by staff turnover and parent work absenteeism due to childcare issues. So from these numbers, we can tell that addressing childcare shortages and instability is likely to have impacts that extend beyond the immediate child and their family to local communities. Rural counties in Indiana have lower childcare capacity. This is a screenshot of a page from a needs assessment report that my colleagues and I worked on for the preschool development grant, which shows the percentage of available childcare slots for the population of children ages 0 to 5 in 2023. The dark blue counties indicate higher access, while the lighter blue counties indicate lower access. And I flagged 5 counties here with the lowest capacity, which would be designated as rural or mixed counties according to our definition that I'm going to describe later. For example, Fountain County, designated as rural, has the capacity to serve less than 4% of its young children in child care programs, and LaGrange County, designated as mixed, can serve only 3% of its young children. And this is in comparison to urban counties like Tippecanoe, which can serve over 50% of children ages 0 to 5. Childcare costs also play a role in access to care. Subsidies are federal money provided to states and territories to help pay for the cost of childcare so that families with low incomes may work, attend job training, or continue their education. The largest funding source of childcare subsidies across the U.S. is the Child Care and Development Fund, or CCDF. CCDF was created in the 90s out of the need to support women in the workforce, and research suggests that CCDF does indeed improve economic self-sufficiency, promote stable employment, contribute to economic development, and reduce barriers to high-quality care. This is a screenshot of the subsidy dashboard that's available on the Indiana Family and Social Services Administration website. As of February 2025, approximately 63,000 children were served by subsidies in the state. However, current funding levels for CCDF will only sustain vouchers for 48,000 children, and that's represented by this black line that you can see in this figure here. And you can already see the counties that are orange in this map are those where the number of children served by subsidies has declined over the past 12 months. Many of them being rural or mixed counties. So CCDF offers critical resources, financial resources to families, but not everyone who needs care has access to that support. For this project, it might be helpful to understand how subsidies are funded. This is like a very simplistic infographic that I created that illustrates how money makes its way from the federal government to families and childcare providers. So the federal government allocates money based on a formula to each state, what is called lead agency, which in Indiana is the Office of Early Childhood and Out-of-School Learning. The state lead agency administers the subsidy program and determines eligibility and reimbursement rates to providers. Eligible families apply for subsidies and are provided a voucher to use at a participating child care program. And then the state reimburses the child care program for providing these services at a rate that has been historically determined by the market rate. However, one important caveat is that the cost of providing care often exceeds the market rate. So providers may lose money in that transaction. They may need to charge families overage fees or come up with that difference in revenue from other sources. So the question is, why might that be a bigger problem in rural counties? Well, in rural counties, we see that incomes of families are typically lower, which means that they may not have the ability to pay overage fees or charge the private pay families a lot more. Additionally, subsidy reimbursement rates are lower in rural counties in general because the market rates that I mentioned that get used to determine subsidy reimbursement are often based off of the fees or tuition providers charge families to stay competitive, and not necessarily what it truly costs to deliver services. And finally, rural programs may not have enough stable revenue coming in from other grants or local philanthropy or private charitable donations, which are important and necessary additional sources of revenue. So what we see is sort of this vicious cycle, and I didn't want to title the slide this way, but I wasn't sure how else to describe this. But in this project, we analyzed some secondary data that came from cost modeling done for the American Rescue Plan Act payments to childcare providers after COVID. And what we noticed is that indeed, rural childcare programs were reporting lower operating costs. So in the bar graph on the left, you can see reported cost per child per week for a rural center versus an urban center. And we see that the rural providers typically report their costs being about $105 lower per child per week than urban childcare programs. And we assumed maybe this is because they're charging families less money than urban centers, so they're pressured to keep their costs down. And as a result, they're provided lower reimbursement rates to cover the cost of care because, again, the market rates they charge to families appear to be lower. And this kind of fuels a cycle that is difficult to get out of. What we had heard anecdotally from a few rural child care directors that motivated this project is that these estimates of the cost of care from market rate studies or cost modeling approaches are severely underestimating their true costs to provide care. So what we attempted to do in the study is figure out why they're reporting such lower costs, what are the drivers of costs, and that way we figured we might be able to identify opportunities to potentially break this cycle. We had a loosely structured hypothesis for some of the questions I just mentioned. Findings from previous research indicates that main costs providers incur include personnel, facilities, supplies and materials, and that costs are higher for programs with features associated with quality. So in this study, we wanted to better understand the assumptions that are at the root of these lower reported operating costs across these 4 large categories. So again, we think that the methods potentially for calculating subsidy reimbursement rates or the cost estimates models might be underestimating the true cost of operating a rural child care center in Indiana. So our ultimate goal was to develop a survey tool informed by child care director experiences operating a rural center that would produce more accurate cost estimates to be used in future initiatives, perhaps even for determining subsidy reimbursement rates. We received a generous grant from the North Central Regional Center for Rural Development in 2022 to conduct this work. We're very grateful to have had their support on this project. So I just wanted to make a shout out to them. Now we'll just move on to the methods here. We took a mixed methods approach. So first we conducted focus groups to identify the drivers of costs in rural counties and where our cost modeling assumptions might need to be updated or refined while we're trying to determine the drivers of these lower reported operating costs. And then second, we use this focus group data to refine and test a revised survey tool that we hoped would better capture the true cost of providing care in rural Indiana. For today, I'm going to focus on what we learned from the focus group data and not the survey tool that we piloted. So we use the 2013 Purdue Rural Indiana Classification System to classify counties into 3 categories across the state as either urban, mixed, or rural. If you're not familiar with the system, mixed counties are essentially a rural county with a larger town incorporated. We have Tanya Hall to thank for helping us come to consensus about this definition, because as I'm sure a lot of folks know who are listening, there are many different systems for defining rurality, and this is definitely not my area of expertise. And so Tanya helped us determine the best approach. She cross-referenced the county classifications from the 2013 system with the 2020 census data, which was the most recent data at the time that we had, to make sure that the 2013 classifications were still accurate based on population changes that had occurred. The 3 counties that are highlighted in yellow, which are LaGrange, Wells, and Whitley, changed from rural in 2013 to mixed in 2020 based on the updated census data, but all the rest of the counties remain the same. In total, there were 75 counties that we classified as rural or mixed that we were able to recruit from. We included mixed counties in our study, which is, I know, a little bit of, I don't know, maybe a surprise, because otherwise we would have had a really hard time getting a sample that we needed, because many rural counties only have 1 childcare center. So I am calling this, rural Indiana, but there's the caveat that mixed counties are included as well. We obtain lists of all childcare centers in these rural and mixed counties from the childcare resource and referral agencies across the state. They provided our research team with the names and contact information of 213 centers in the 75 eligible counties. Of those 213 centers, 102 were determined to be center-based programs, not located or affiliated with an elementary school. And we limited our participant pool to center-based programs for simplicity in the study, because family child care homes, centers in public schools, and ministries operate very differently. We proceeded to contact those 102 programs through sending postcards, calling on the phone, emailing, and in some cases, dropping in for a visit. 21 directors ended up enrolling, and 18 actually followed through on scheduling a focus group. Our target sample size was 40, but the team, and especially the undergraduate students, did a lot of work just to get 18 directors on board. So we're really grateful, knowing all they have on their plates, that they were willing to share their experiences with us. The focus groups were conducted in November and December of 2022, and then the directors were invited to complete a follow-up survey for the revised tool in October 2023, and everyone was compensated for their time. Participants represented childcare directors from 14 counties. A third were operating childcare in what was designated a rural county, and 2/3 were in mixed counties. 94.4%, so I think that's 17 out of 18, accepted childcare subsidies. Directors of all centers served preschool-age children, and most serve infants and toddlers. Very few centers serve school-age children. The majority of directors were operating a level 3 or level 4 center on the paths to quality, which is considered high quality in Indiana. 72% of the participants identified as white, and the remaining 28% identified as multi-ethnic or multiracial. As a reminder for the study, our goal was to understand why rural childcare directors might report lower operating costs. So we decided to show them the same data that was taken from the American Rescue Plan Act cost study, and use this as a jumping off point for our discussion in the focus groups. So first, we presented the graph on the left that I had showed previously. We extrapolated the cost difference out to a hypothetical program with 20 children over the course of a year to demonstrate the magnitude of this difference. And then we asked childcare directors whether they agreed that expenses should be that much lower in rural compared to urban centers, and why or why not. Then we broke down this difference of about $105 per child per week across the different categories of expenses that we assumed would be the drivers of costs, or the largest factors that influence costs. And we developed a line of questioning around each of these categories that would help us to determine how directors made decisions around their wages, their staffing, their materials, their facilities, etc. So this is just an example of some of the questions we asked in the personnel wages category. We employed this line of questioning for the other categories included in the graph as well, and we thought this approach might help us to get to the bottom of why directors were potentially underreporting their costs and what assumptions we were getting wrong in the cost estimation models. Each of the focus groups lasted about 60 minutes long, and we ended up with 540 total minutes of data to code. So it was a lot of information for us to wade through. We had two separate but simultaneous efforts going for our coding, which was actually helpful because even though we were looking at the data from different perspectives, we came to similar conclusions, which can be seen as sort of a validation exercise. In the deductive approach, George Rickus started with a set of predetermined codes that stem from the cost modeling survey tool, and he was our solo coder for that effort. And the inductive approach, we spontaneously generated a set of codes that emerged from patterns in the data. A team of us generated, applied, and updated those codes. And I'm going to share the data today from the inductive coding that we did. But again, many of these codes were consistent with the a priori codes. This is an infographic of our iterative coding process, which we implemented across 5 phases. I will say in all transparency, I am not a qualitative researcher. I work with numbers, not, text. So this was all very new to me, and I'm grateful to have my partner and graduate student Jacqueline Sandell in crime for this, because we really had to stretch our brains on how to make this work. So in phase 1, our coding team, including myself, Jacqueline, and a group of undergraduate students read a single passage from the focus group transcript and shared our initial impressions as well as keywords that stuck out to us. Then myself and Jacqueline reviewed the keywords and determined our initial coding method, and we decided to use process coding, which captures the thoughts, actions, and behaviors described by participants, because we noticed a lot of verbs ending in ing were the predominant keywords that had stuck out to all of us in our first read of the transcript. In phase 2, Jacqueline and I randomly selected a single transcript from a focus group to preliminarily code, and then we reviewed our codes together, searched for similarities to retain, and narrowed our list of codes down to 50. In phase 3, Jacqueline trained the rest of our coding team of undergraduate students on our codes, their descriptors, examples, etc., and conducted reliability testing until each of the team members reached 75% agreement. Then members of the coding team were assigned 2 to 3 transcripts to independently code, and Jacqueline reviewed and revised the code application as new codes emerged or as existing codes were consolidated or removed. And then in phase 4, Jacqueline further refined the codes and made sure that they were applied consistently across transcripts. In the final phase, I grouped together the codes to establish some of the themes that you'll see today and assign meaning. Okay, time to see what we found. And I am 2 minutes behind, so I'm going to try to pick it up here. We identified 3 themes that the codes fell into. The first, enduring challenges, includes codes that represent persistent challenges directors experience that may impede their ability to operate their center in an ideal or desired manner. The second, impacting work and life, includes codes that represent the consequences of these challenges for directors' daily work hassles and personal life. And the last, overcoming obstacles, includes codes that represent the strategies directors adopt to navigate their difficult circumstances and overcome obstacles. So we'll take a closer look at all 3. Within enduring challenges theme, we had 12 codes. You can see the process code in the first column, the number and percentage of directors whose responses those codes were applied in the second and third columns, and then the description of the code in the fourth column. And these are presented in order of their frequency. So I'll just pause and give you a minute to read through these. Okay, now we'll take a look at examples for each one. So here are 2 excerpts pulled from the data that demonstrate the code lacking funds. In the quote on the left, the director is sharing their desire to employ more staff if they had more money. In the quote on the right, the director is stating they would compensate their staff more if they had more money. I'm going to pause again for a few seconds after sharing each of these examples to give you some time to read them. Okay, Here are two excerpts that demonstrate the code naming financial stressor. The director on the left is expressing how unexpectedly losing a family can contribute to a sudden loss of revenue. The director on the right is similarly describing how families falling behind on their payments might contribute to financial stress. Here are two excerpts that demonstrate the code identifying rural challenges. The director on the left is describing how the lack of access to big box grocery stores in rural areas might explain higher food costs. The director on the right is sharing they had to settle for an old doctor's office building to repurpose as a new childcare facility. Here are two excerpts that demonstrate the code burdening families. The director on the left is recognizing that raising rates any higher may become unaffordable to the families in their area. The director on the right is acknowledging the trade-offs to families with providing paid vacation for staff. Here are two quotes that demonstrate the code not profiting. The director on the left is explaining how their center runs a deficit every month, and the director on the right is sharing that they are breaking even on their profits, but may start losing money soon. Here are two excerpts that demonstrate the code competing for staff. The director on the left is explaining how they struggle to compete with the wages of local fast food restaurants, and the director on the right is describing the competition with local factories. Here are two quotes that demonstrate the code revolving door, and this was a term that was actually used by one of our participants. The director on the left is describing their turnover challenges and how that impacts staffing in classrooms on a day-to-day basis. The director on the right is sharing that they have an empty classroom they can't open because of staff vacancies. Here are two excerpts that demonstrate the code doing everything. The director on the left is explaining that the job requires them to be multifaceted. The director on the right is sharing an analogy that they are running around putting out fires throughout the day. Here are two excerpts that demonstrate the code supporting child development. The director on the left is recognizing that the needs of young children have changed over time. The director on the right is expressing how extra support in the classroom could benefit both the children and teachers. Here are two excerpts that demonstrate the code lacking experience or quality. The director on the left is sharing that most staff they hire don't have childcare experience. The director on the right is explaining how this lack of education and experience impacts their staffing decisions within the classroom. Are two excerpts that demonstrate the code having a wait list. The director on the left is describing how they forfeit potential families to enroll because they don't have the slots available immediately. And the director on the right is explaining that their wait list is so long because they retain families due to the lack of other options in the area. And this is the last code for this theme. These excerpts demonstrate competing with local schools. The director on the left is sharing their competition with public schools for funding because of their participation in On My Way pre-K. And the director on the right is explaining how families might perceive pre-K in public schools to be more educational than childcare. Okay, on to the next theme. 9 codes fit within the impacting work and life theme. As a reminder, these codes represent the consequences of challenges for directors' daily work hassles in their personal lives. We'll look at examples for each one of these. Again, the process code is in the first column. The number and percentage of participants whose responses were coded according to this code are in the second and third columns, and the description is in the fourth column. Here are 2 excerpts pulled from the data that demonstrate the code expressing emotions. In the quote on the left, the director is expressing their sadness and disappointment that they have empty classrooms that they cannot staff. In the quote on the right, the director is sharing their feelings that childcare teachers often go unrecognized for the essential work that they perform. Here are 2 excerpts that demonstrate the code naming other stressors. The director on the left is explaining how quality requirements associated with serving preschoolers is a major stressor for them. The director on the right is sharing how managing staff call-offs contributes to their burnout. These 2 quotes demonstrate the code perceiving programs as inefficient. The director on the left is explaining why they believe raising CCDF income eligibility might be beneficial. The director on the right is sharing their views on why the Child Care and Adult Food Program, or CACFP, falls short. Here are 2 quotes that demonstrate the code making hard decisions. The director on the left is sharing their recent decision to close a preschool classroom. The director on the right is describing an experience where they had to remove a child from their program. Here are 2 excerpts that demonstrate the code worrying about the future. The director on the left is expressing general concern about the sustainability of Indiana's childcare system. The director on the right is communicating their fears about being able to sustain their program long term. Here are 2 quotes that demonstrate the code recognizing physical and/or mental toll. The director on the left is discussing how teachers are becoming overwhelmed quicker than in the past, trying to manage challenging behaviors. The director on the right is describing how their staff delayed medical procedures during COVID that now need to be addressed. Here are two quotes that demonstrate the code struggling to persist. The director on the left is recognizing that they're at a point where they need more help with substitute teachers in order to continue to care for children. The director on the right is also expressing their need for more staffing help in order to get by. Here are two excerpts that demonstrate the code making personal sacrifices. The director on the left is explaining how they often put their family on the back burner to prioritize their work. The director on the right is sharing they have foregone earnings for the past 5 years. And this is the final code for this theme. These quotes demonstrate perceiving policies as inequitable. The director on the left is expressing they feel it's unfair how public schools get money for pre-K. The director on the right is explaining how funding formulas for the COVID stabilization grants did not provide the same advantages to small rural centers as they did for larger urban centers. The final theme is overcoming obstacles, which also included 9 codes. As a reminder, these are the strategies directors adopted to navigate the challenging circumstances and overcome obstacles. We'll take a look at an example for each one of these after I give you a second to read them. Here are 2 excerpts that demonstrate the code relying on external funding. In the quote on the left, the director is explaining that they heavily depend on outside funding sources from state programs and grants. In the quote on the right, the director is describing a private partnership they are developing with a local company that has helped to keep them afloat. Here are 2 excerpts that demonstrate the code determining feasible rates. The director on the left is explaining how they typically set their tuition based on the market rates. The director on the right is sharing their approach of setting tuition based on the median incomes within the county. Here are 2 excerpts that demonstrate the code implementing pay incentives. The director on the left is describing their pay structure for teachers based on each subsequent level of education completed. The director on the right is sharing they provide bonuses for staff based on their attendance each month. Here are 2 excerpts that demonstrate the code navigating understaffing. The director on the left is sharing that they constantly shuffle teachers around in order to make sure the classrooms are staffed appropriately. The director on the right is explaining that they are intentional about hiring in non-teaching positions like cooks and janitors, so those individuals are qualified to fill in for teachers if needed. Here are 2 excerpts that demonstrate the code pinching pennies. This is also a term that came from one of our participants. The director on the left is explaining how they have saved money by not outsourcing services like cleaning. The director on the right is sharing they save money by accepting donations for supplies and purchasing used furniture for classrooms. Here are 2 excerpts that demonstrate the code countering staff attrition. The director on the left is sharing that they try to retain staff through developing personal relationships, and the director on the right is explaining their approach of offering more paid vacation to help their staff recover. Here are two excerpts that demonstrate the code persevering. The director on the left is communicating they're hanging in there. The director on the right is sharing similar sentiment of trying to remain positive. Here are two excerpts that demonstrate the code playing multiple roles. The director on the left is listing all of the jobs they fill as director. The director on the right is also explaining the many hats they wear. And finally, here are two excerpts that demonstrate the code modifying operating model. The director on the left is describing how they changed their food operations to reduce costs. The director on the right is explaining that they now charge parents a late fee for not submitting their child's attendance in a timely fashion. Okay, that was a lot. So we'll do a quick recap and then happy to have discussion afterwards. So in analyzing this data, we found that childcare directors experience challenges hiring and retaining qualified employees, which limits their ability to fully enroll classrooms, resulting in less efficient operating practices. This may be in part due to local market competition in rural areas. Although they are not profiting, directors do not consider raising tuition rates to families a viable option for increasing their revenues, and they perceive some government programs like CCDF and CACFP that are supposed to provide benefits as being insufficient or inequitable. Despite these barriers, directors remain determined to find solutions that will enable them to continue offering high-quality care to local families, which we thought really demonstrated their resilience. Many times, they employ strategies that appear to be at a cost to their own personal or financial well-being, including working long hours, taking on many roles, foregoing wages, and internalizing emotions. So how do these results align with our initial hypothesis? Going back about 30 minutes or so, we found that the data generally supported the notion that assumptions behind these cost drivers might be inaccurate. Specifically with regards to personnel, we determined that rural child care directors are likely staffing at a lower rate, having one person work multiple jobs, which may explain this difference in per child cost between urban and rural centers. Constant turnover was also notable in their responses, which contributes to understaffing issues, which is not captured in our typical cost modeling tools. And directors agreed that they're not able to charge families more in tuition, so wages may also be suppressed. For facilities, the directors mentioned they have a lack of access to many options, which means they may have to settle for operating a smaller center that does not have the ideal capacity. They also shared local competition with public schools, which means they may lose families because of the perception that public pre-K is more educational for children. For supplies, we heard how rural centers save money by accepting donations or relying on used materials. They also may shop for their own food instead of using a vendor to keep costs down. And for quality, we learned that directors might be cutting some of their programming for preschoolers because they simply cannot afford the expenses that are associated with it. Additionally, there was a general sentiment shared among directors that providing quality experiences and continuity of care for children is important to them, but they may be undermining this effort because of the necessity to have larger teacher-to-child ratios or because they lack experienced teachers. So I'll end with a few recommendations that came out of this work and that are informed our revised tool. First, based on this data, we have even more evidence as to why states should discontinue the use of market rate surveys for determining subsidy reimbursement rates. We heard from directors that market rates are based on what local families can afford and are willing to pay and not the true cost of care. Second, we learned that rural directors are understaffed, which makes it look like on paper they have lower costs. So reimbursements should be calculated to try to bridge the gap between actual and desired operations. Third, reimbursement rates should take into account local economies that may drive competition, impact recruitment and retention, or suppress costs. And finally, the methods for calculating reimbursement rates should consider socioeconomic factors of the community, as well as the needs of children and family. We heard about the unique developmental and behavioral challenges of young children that have increased strain on directors and teachers. And without the finances to provide an extra staff member for support in these classrooms, the quality of care may be suffering. The last thing I want to say is just thank you to the entire childcare workforce, who I agree is often unrecognized and underappreciated for the critical services that they provide our youngest children in the next generation. And I'm happy to take any questions or have discussion at this time.
Great, thank you, Jen. That was really interesting. A lot to take in. So if you have any questions, please go ahead and put them in the chat. We're a small enough group that I think you can maybe raise your hand to be unmuted, but otherwise, please put questions for Jen in the chat.
I overwhelmed people with information.
We have a question. Did any policy recommendations come out of the study?
I have not shared this yet with anybody, but I plan to. The recommendations that I just shared are the recommendations that I would have, and but yeah, they have not been shared yet with people in the positions to make those decisions.
Like there's many of the same issues in rural Ohio. I have to tell you, Gwen, one of the things that came out of the listening sessions that we did nationally, regionally and nationally, was childcare and caregiving and issues in rural areas, from all the way from cost issues to turnover. And yeah, so definitely this is an issue that's for many rural areas.
Yeah, I think there are broader implications for sure for other states who are struggling with some of these same factors. And yeah, and even though this was right after COVID, I should say, I think some of these issues are still relevant today. I know at least in Colorado they are.
I know looks Kayla is also in rural Wisconsin. So.
Yes, Gwen, I see your note. Yeah, that's a huge concern a lot of people have right now of what impact that non-renewing Head Start may have if that happens.
Any other questions, comments? Okay. Well, thank you all for coming to the webinar. Thank you, Jen, for providing a very interesting webinar on Indiana, but obviously it expands more than Indiana. Some of these issues, I think they would pretty much be universal if you had done a focus group on for rural caregivers. I do want to give a shout out that we do have the NCR Star Caregiving Survey. So I'm assuming you're here because you're interested in caregiving and childcare. And so there are two for the Northeast and the North Central, there are surveys that look at caregiving across the lifespan. So if you're interested in this and want some data to go along with some of this, please go ahead and use that. Jen, again, super thankful. This was a great webinar and gives us a lot to think about and take to others. Our next webinar is May 9th at 3 p.m. Eastern, 2 p.m. Central, and it'll be on the 2024 baseline surveys. Again, thank you so much for joining us. And again, thank you, Jen, for this wonderful webinar.
Thank you for having me, and thanks everyone for being here.